This video shows you how to use the SR Vivodent SPE Shade Guide to correctly determine the tooth shade, tooth size, and lip length. The Shade Guide features an integrated facial and papillometer to assist you in gathering these data. After you have taken a functional impression and bite registration, select the desired tooth shade and shape in consultation with your patient. Discuss distinctive anatomical features and personal preferences with your patient. Select the tooth shade on your patient under defined light conditions at a color temperature of 5,500 degrees Kelvin or under daylight. The sample teeth of the SR Vivodent SPE Shade Guide feature the same layering structure and material as the original SR Vivodent SPE molds. This results in fewer and less severe shade deviations. You can also determine the shape, size, and position of the teeth on the basis of old photographs of the patient. Use the facial meter to measure the interocular width of the patient's nose. The value measured with the facial meter corresponds with the tooth size ranges small, medium, and large displayed on the reverse of the Shade Guide. Each tooth size range is available in the three basic shapes: triangular, oval, and square. The mold chart shows the tooth sizes in these three basic shapes. This helps you to identify the appropriate tooth molds with ease. In square tooth molds, the center incisor is dominant. The vertical labial curvature is moderate. Triangular molds are characterized by teeth having a crown which tapers towards the cervical ridge. The labial vertical curvature is slightly marked. Oval tooth molds display pronounced curvature characteristics. The labial curvature is particularly marked. The tooth mold chart also assists you in selecting the appropriate size of posterior molds to match the anterior ones. This range of choice enables you to consider and meet the functional and aesthetic needs of your patient. Use the papillometer to determine the length of the upper lip and the lip closure line. Position the papillometer on the papilla incisiva and then determine the length of the patient's lips, first when the upper lip is relaxed and then when the patient smiles. This value allows you to draw conclusions regarding the length of the anterior teeth. Clean and disinfect the instruments before every use. Only use equipment that is in full working order technically and hygienically. Clean the Shade Guide teeth by wiping with disinfectant, for instance, with disinfecting wipes. Wipe the teeth for at least 10 seconds. Dry the teeth with compressed air or with a clean, lint-free cellulose cloth. Sterilize the instruments and Shade Guide immediately after use in an autoclave for 5.5 minutes at 134 degrees Celsius, using the pre-vacuum function.